Hello, welcome to another post from Dr. Blake's Healing Soul. Today our athletic trainer, Aphrodite, will explain to a patient how to do ankle and foot strengthening exercises.
Okay, so we're going to start with ankle TheraBand exercises first. So what you want to do is go ahead and straighten your foot leg out and then go ahead and relax it. It's going to be a little harder to do on a chair, so for this particular exercise it's actually better if you're on the ground seated, if you don't mind doing that. And then go ahead and straighten your leg out. Okay. So we're going to go all four directions for ankle strengthening. The first one is going to be dorsiflexion. So I'm going to do is hold the band down. When you do it yourself, you can tie it to something like a table leg. And what you want to do is, with your foot, you want to go up towards your body and then slowly back down. So try to keep your lower leg nice and stable. It's just your foot going up and down. And let me know if it's too much tension or too little tension. Try to go as far up as you can. Good. So the muscle primarily worked in this exercise is your anterior tibialis muscle. So you should kind of feel it all through the front of the leg. And let's do a set of 10, if you can tolerate it.
You can see how a knot has been tied in a TheraBand.
Okay, go ahead and take a break after this one. So for the next one, you're going to hold on to the band, and we're going to go the opposite direction. So you're going to go into plantar flexion, down, and back up. So for this one, we're working the calf muscles in the back, so you should feel it. And again, a set of 10, take a break. Okay. For the next one, we're going to go into inversion. So I'm going to hold the band out this way. With just your foot, you want to go in this way and back out. And try to keep that lower leg nice and still when you do that. Good. Try to really control it, especially on the way back. Good. So this one, we're primarily targeting posterior tibialis muscle, which attaches to your tibia bone here underneath the calf, wraps around, pulls your arch up.
It's important for the patient not to move their knee.
Right, keep that lower leg nice and still. It's better. Okay, and the last one's going to be eversion. So this time your foot's going to be going out this way, and again keep that lower leg still, and then back in. Good. So this one you should feel in the peroneals on the side of the leg.
You can see how she's pulling against the resistance of the band, which is parallel with the motion. very strong, I'd say.
Okay, good job. Okay, next we're going to do some intrinsic muscle strengthening. So go ahead and have a seat on the chair. So we're going to do what's called towel scrunches. So what you want to do is try to pick up or kind of scrunch the towel with your feet. You probably won't be able to actually pick up anything, but the point is to try to get that motion so that you're working all the muscles inside the foot. Try not to move your whole foot. Try to keep it nice and still, and then just use your toes, and your whole foot kind of comes up.
How many of these do you tell people to do?
Again, a set of 10 is good. Take a little break, and then I would do anywhere from 1 to 3 sets is good of 10.
You can see the fatigue setting in.
So if you start to fatigue after, let's say, a set of 5, go ahead and take a break. You don't have to go all the way to 10. So depending on how the severity of the injury, things like that, how weak you are, just kind of modify it that way. So another good exercise is called Domine. So this time we're not using the toe flexors as much, or if at all. Kind of want to think about pulling from the arch of your foot. So you're kind of doing more this motion instead of actually curling your toes in. So try that next. So you're kind of pulling up from here. It's a very, very subtle motion. Good.
I always tell my patients to make sure that on this exercise that they can still see their toenails, so they're not firing the long muscles to the toes. Trying to draw up that arch. Can you feel that? The
Yes.
the arch pulling?
Definitely.
Good. Subtle but powerful.
Okay, very good. Now come on up, we'll do some calf raises. So I like to do it kind of up against a wall so I have some support. You want to keep your toes nice and pointed forward, body nice and upright. What you want to do is raise up the ball of your feet and come slowly back down. Nice and slow and controlled. So you don't want to be coming up this way or leaning back. You want to be as straight up as possible towards the ceiling, back down. So I would do a set of 10 double leg, go to single leg, if tolerable, another set of 10. Go ahead and try that. So remember, go straight up towards the ceiling. There's a string from your head to the ceiling and it's pulling you straight up. So we're working the calf muscles in this one.
Perfect. You can see how she goes straight up.
And if you're not ready for this level yet, to lift your whole body weight up, you can start with the same thing, but you're seated on a chair. And then you can do it this way. If that's too easy, you can add some weight with your hands and do it like that. Just modify it that way. Try to put as much weight as possible into the big toe, because you're putting a lot of weight on the outside of the foot. So you're trying to keep it a little more level. good exercise is single leg balance. So you can either do it up against a wall if you feel a little unstable, or just on the floor. And you're going to try to just balance, keeping your core nice and tight, body nice and upright, and then try to balance for a minute if you can. If that's too easy, do it with your eyes closed. You can roll up a towel or some sort of unstable surface and try to balance on that. It makes it harder. So try that. And always keep a little bit of a bend in that knee that you're, stabilizing on. Good.
So if it seems easy, try to do it with your eyes closed. I always like to capture the patient falling into the wall on video. Very good. Great. All right. Thank you, Aphrodite.
You're welcome.